Greeting from China. It's a true honor to be here today to share my knowledge about this topic. My topic is about different treatment protocol for pro-arch patients. My name is Ma Yi. I'm from West China Hospital of Stomatology of Sichuan University, located in Sichuan, Chengdu. It was founded in 1907 with more than 100-year history and is the birthplace of modern stomatology in China. Starting with my today's presentation, I'd like to present a few cases that I have completed long ago. From these pictures, you can see that several problems are presented. Maxillary anterior teeth couldn't be seen when talking. Spallation of recent teeth. I even received a note from a patient on which he wrote all kinds of complaints, which can be summed up in two aspects: aesthetic and functional problems. Are these problems accidental? According to the literature, the most frequent biologic complication of full-arch fixed dental prosthesis is peri-implantitis, and the most frequent mechanical complication is chipping of the veneer ceramic. So we have been thinking about how can we prevent these problems prior to the treatment. Use a complete denture with correct jaw position and the ideal tooth arrangement can help us evaluate the condition of the temporomandibular joint and masticatory muscles, phonetic function, and aesthetic results. We all know that the basic requirement for complete denture include no dropping of maxillary denture, low floating of mandibular denture, pain-free during mastication, and good phonetic function.